it's the morning of my first chemo treatment. I'm feeling super anxious, tired because I only slept maybe 5 hours. And so I thought that I would get some of my anxiety out by making a video and talking about my chemotherapy regimen, hoping that someone watching it who maybe has the same cancer as me and will be having the same chemotherapy medications can follow me and see the kind of different side effects that I have. So if you haven't seen my videos, my name is Melissa, and last month I was diagnosed with stage 2 HER2 positive breast cancer. And so it really depends on your type of cancer and the stage that you're in as to the treatment path that you'll be taking. So because mine is pretty aggressive and grows really fast, they decided that it was best for me to do chemotherapy first and then do a surgery after, and I still need to make a choice on that, whether I just do a lumpectomy or a mastectomy. So I have a couple months to think about that. So my chemotherapy regimen is known as TCHP. And so what that means is there's 4 different chemotherapy drugs. The first one is called, and I'm reading this off my little sheet because I don't have this memorized. The T is for Docetaxel, known as Taxotere. And then the C is Carboplatin. The H is Trastuzumab, also known as Herceptin. That's the more common name. And the P is Pertuzumab, also known as Perjeta. And so those are the chemotherapy drugs that I'll be getting today. I'm going to be getting all 4 for 6 cycles every 3 weeks. After that, I will only be getting the Herceptin and the Perjeta for another 11 cycles every 3 weeks. And so the T and the C, the Taxotere and the Carboplatin, are the more potent ones, the ones that will give me more side effects. And then after that, they said that the Herceptin and the Perjeta have less side effects, and so I'll start feeling a little bit better after that. My hair will grow back, things like that. So I'm just going to go over each medication and the different side effects that I'm going to be experiencing. The first one I'm going to talk about is the Taxotere. And with that one, I will need to take a medication, an oral medication, after I get my injection today. I have to take it on days 2, 3, and 4. And it's called dexamethasone. And so I just need to, I labeled everything, and I'll show you what that looks like, just because I've heard that you get really fuzzy brain and you can't really think clearly. So I've labeled everything for my husband and anyone else that's going to be caring for me so that they know exactly what they need to give me. I don't have too many oral medications. That's the only one that I have to take. And then the other 2 are just for nausea, if I'm feeling nauseous. So this is how I labeled it, and I put it in just a Ziploc bag, put the name of the medication and exactly what the directions say, just so it's more clear for the person caring for me. So the side effects for this medication are, it could burn if it leaks under the skin. So they told me if it starts burning to let them know. Fluid retention, swelling of the feet, hands, or belly. Every single one of these medications says that nausea and vomiting are a side effect. And then they said if I do have a fever, the number that I really need to be focused on is 100.5. And if I have a temperature of 100.5 or above, I need to contact them immediately. With this medication, my white blood cells may decrease 7 days after my treatment. and they usually return to normal 15 to 21 days after. And so this is the time when I have my greatest risk of infection. So I just need to make sure I'm not near a lot of people then. I'm planning on just staying home, especially with COVID. There's a higher risk of infection or me getting sick. So I've opted to stay out of work. I'm a teacher, and I think that's, my doctors both recommended that I do that. And I've also decided to keep my children home. So just to try to minimize any kind of germs that are around me, so that I don't get any kind of other sickness on top of this. This medication can also cause sores in my mouth. And then there's a recipe for a paste that I can make with baking soda and water. So if that occurs, I can use that. Skin rashes, nail changes, muscles and joint pains, tiredness. Every one of these medications also, a side effect is fatigue and tiredness. Hair loss. This is the medication that will make me lose my hair. It's not a guarantee that I will lose my hair, but both of my doctors have said that I more than likely will. So my plan, and it might change after today, after I get my chemotherapy, but right now what I'm planning on is when I start having my hair fall out into clumps, that's when I'm going to decide to cut it, and I'm going to have my children cut it. I think that would be just a great memory for them, to have this be a fun experience for them. My youngest one is not liking the idea of me losing my hair, so I thought that might be a good way to do it. And then after that, I'm not sure if I'm going to just do a pixie cut or have my husband just shave it. So, and then another side effect is numbness and tingling of my fingers and toes. Similar to how I felt when I was pregnant with my second one, my fingers and my hands always felt numb and tingling. So I kind of know that feeling. And then it says hand, foot, skin reaction. So those are the side effects of the Docetaxel. Looks like fun. Sounds like fun. Not really. The next one is the Carboplatin. And with this one, I need to drink lots and lots of water. She said to drink at least 8 to 12 cups of fluid. It can be something other than water, but I am a water drinker, so I don't think this is going to be too difficult for me, but we'll see. With the feeling of nausea, I'm not sure how much water I'm going to want to drink, but I'm going to really try. Again, this is saying a side effect. The first one is nausea and vomiting. They did give me 2 medications for nausea, so the minute that I feel any kind of nauseous feeling, they said to take this first one, which is ondansetron. And then 45 minutes after that, if I'm still feeling like I still feel really nauseous, this is a really long name, prochlorperazine. So I take that as well, on top of the other medication if I'm feeling nauseous. This one will cause my platelets to decrease 3 weeks after my treatment and usually return to normal 4 to 5 weeks. So this is going to make me bleed easier and bruise easier. So they've said no flossing, try to stay away from using knives, which is going to be hard for me because I do cook for my family. And even though people are sending meals and I so appreciate it, there's going to be times when I still want to cook for my family. So I just need to be super cautious of that. No using razors, and even blowing my nose. I need to blow it super gently so that it doesn't bleed. Because if I do start bleeding, it's a lot harder to get me to stop bleeding. And this one also says that my white blood cells will decrease 3 to 4 weeks after my treatment, which is a greater risk of infection. So another reason why, and I just need to stay away from people. And I also am asking anyone who's going to be coming into my house to wear a mask and to use hand sanitizer. This medication does say that hair loss is rare. So I think it's the first one, the Docetaxel, that will be making me lose my hair. And the next one, Herceptin, this one doesn't have too many side effects. And that's one of the ones that I'll be taking for a full year. So I'm thankful for that. They said fever, chills, and flu-like illness may rarely occur. Pain and tenderness where the needle's placed in my port here. All of them say that for a side effect. And nausea and vomiting again. And my wonderful sister-in-law last night gave me a huge bag of different products that I can use during chemotherapy. I'll be making a separate video about different products to use, but one of them was the C-band, so that's going to be helpful also during the times that I feel nauseous. And the next medication is Perjeta, and so that one, nausea and vomiting again is at the top of the list. Diarrhea, sore mouths again, so there's 2 different medications that will be causing me sores in my mouth, and swelling of hands, feet, lower legs. And then it says hair loss is rare with this one, tiredness again, but trouble sleeping, so that should be a fun one. So there's quite a few side effects. Feeling pretty nervous about this. I wasn't nervous until about last night when it just started hitting me, all the different side effects that I could have, and people take it differently, so I might not experience all these different side effects, but I will be doing a video on my chemotherapy treatment, starting with this first one. This is considered day 1, and then tomorrow will be day 2 of chemotherapy, so there's a couple other things I just want to talk about. There was a lot of misconceptions with people who are on chemotherapy. Things like you can't be around your family, you have to use a different bathroom. And so I asked those questions during my chemotherapy education. And she said that the biggest thing is that your waste comes out 24 to 48 hours after receiving chemotherapy. So I just need to make sure that when I use the bathroom, I close the lid and then flush. And that's like the major thing that I need to do. Other than that, my laundry would be washed separately only if I like threw up on it or something, but if not, it can be washed with my family's laundry. I asked about my daughter. She crawls in bed with us quite often still, and she said she can still do that. That's not a problem. So, you know, just being cautious, but I don't need to use a separate bathroom than my family. I don't need to use a different shower, things like that, but I just do need to be cautious in the first 24 to 48 hours. And then the other thing that we talked about was obviously not getting pregnant while doing chemotherapy. They did ask me if I'm finished having children, and we were kind of not really sure before this. We were just kind of letting things happen and whatever happened, but we're totally fine being done. I'm very blessed with my 2 children that I have, and so we are not choosing to have more children. But if we didn't really get to the process of what to do if we were, but I've heard that freezing your eggs is a good option. So I would have to do that if I wanted to have more children, but I'm not. So that's just something to be aware of if you are still wanting to have children after chemotherapy. So I hope that this was helpful for you. It's helpful for me to talk about it and to understand my medications a little bit more. So please like and share, and we'll see you soon.